between 700,000 and 1 million patient falls occur in U.S. hospitals each year, with 33% of these resulting in injury, costing the U.S. about $50 billion annually. Falls in hospitals are a big problem, and prevention strategies are complex due to both intrinsic and extrinsic factors contributing to fall risk. Most existing fall prevention strategies are limited and don't address the whole problem. We propose a fall prevention strategy that aims at redesigning a hospital room to really prioritize patient safety. With each hospital room and the objects in it being different, we need to first look at their characteristics. So we've broken objects down into 3 general characteristics: height, movability, and graspability, with the subcharacteristics of seat pan, armrest and backrest height, the resistance to movement and compliance of surface, and the type of grasp and smoothness of grasp. By breaking these objects down into characteristics, we can really build a foundation to understanding how these work together to allow an object such as a chair or bedside table to either provide good support to a frail individual moving about a room or cause additional fall risk. We've surveyed 66 individuals who have interacted with mobility impaired patients in a place of employment in the last 5 years. The survey presented 5 scenarios, and respondents were asked to rate the level of influence from 1 to 5 that each object characteristic has on a patient's safety and stability during that scenario. We found that for sitting tasks, height and movability were perceived to be more influential than graspability in providing support and stability. Seat height and armrest height were perceived more influential than backrest height. For walking and turning tasks, independent of whether or not the patient was actively or reactively using the supports after a moment of imbalance, there was no significant difference between height, movability, and graspability. However, there was a significant difference in the subcategories. The resistance to movement was perceived more influential than the compliance of surface, and the type of grasp was perceived more influential than the smoothness of the grasp. This tells us that for tasks involving gait, it is the interaction between height of the support surface, its resistance to movement, and the type of grasp available that make an object either a safety hazard or a good support surface. From the results, we can also conclude that sitting tasks may require slightly different characteristics for safety and stability than tasks involving gait. The next step of our research is to investigate and quantify exactly how height, resistance to movement, and type of grasp work together to provide a good support surface for a frail individual moving about a hospital room. Thank you.